healthcare bill debate right now means added stress for the average American. With all the uncertainty, people are wondering whether they're going to have insurance. Dr. Rafi Wald, a licensed clinical psychologist, joins us to talk about this issue. So you've had a lot of people coming in your office saying, oh no, what's next for me? On top of all the daily stresses in life, I would imagine.
Yeah, definitely. And people that have mental health issues, that have psychologists and psychiatrists that they rely on, this just adds another layer of stress for them. Definitely, it's a major issue.
Because they're thinking, oh my goodness, am I going to be able to keep my same doctors? Am I going to continue my care? Is that the thought process?
Absolutely.
So what do you tell people who come in and they're concerned and they're worried, what does this mean for me?
Well, I talk through a lot of issues with them. I talk to them about their options. We talk about what they can do if their health care does not cover the psychologist or psychiatrist or myself that they're currently used to seeing. Most important really is that if there is a mental health issue, if there's a crisis, you should always seek care first. The finances can be taken care of later, but a loss of life, God forbid, cannot be taken care of later. So always seek mental health care, always seek emergency services if you need them.
And what do you tell caretakers out there? There's a lot of caretakers probably watching this and thinking, oh goodness, you know, I'm caring for my brother or my in-law, and I'm worried about this. So what can they do today to start securing things to make sure they know what they should do if in fact they repeal this?
They should always talk to their primary care provider about what their options are. One thing I wanted to touch on quickly was that there always are a lot of barriers to mental health care, and this sort of adds another layer to it. One of the biggest ones is the stigma of mental health problems. My hope is that someday we will get to a point where mental health problems are a lot like medical problems. We see them as being the same, like diabetes, for example. Seizure disorders like epilepsy, those are a brain disorder that a person does not have control over. Depression is also a brain disorder, but for some reason we as a society see people that have depression as needing to just suck it up and move on with their lives already, but it's really not the case. People need help. So someday I hope that we see all of these issues as being equivalent.
Well, and I think it's important you're here talking about this. Not only is it on top of a lot of people's mind, but it's also important that we know it's okay to talk about it. It's okay to reach out to these professionals and say, hey, what happens if? So you kind of have a plan, so you know that that's just one less thing you have to worry about.
Absolutely. I'm a big believer in the primary care physician. Please talk to your primary care physician about what your options are, and don't be embarrassed to talk to your primary care physician or one of your other care providers about a mental health problem.
And like you said, we've got a lot of issues going on in the world. Things to worry about. This really shouldn't be one of them. So glad you're tackling this topic. Doctor, thank you so much for joining us. Good information there. We appreciate it.